Thank you very much. It's really hard to be the last speaker on a tremendous panel, and I want to thank our presenters for taking aim at obesity. And I'm going to change it just a little bit because I really feel that we also need to tackle obesity in the Latino communities because they are, as Dr. Cheng just mentioned, the fastest growing U.S. minority population. 1 in 3 individuals will be Latino by 2050. And I'm going to share with you very quickly some data on how obesity is impacting Latino children in particular. And one caveat that I want to leave with you, sorry, I got ahead of myself. Okay, to go back here. One of the caveats that I'd like to reiterate through this presentation is that we have very little population data and specific evidence that's what's working within our Latino communities. So I'll try to show that we're trying to create new data and grassroots level data and policymakers to develop new results and outcomes to put this in the hands of local leaders, policymakers, and decision makers who we can start making a difference in the fight against Latino childhood obesity. And because that's what it's all about, taking new evidence and bringing it to the public and the political realms so that we can have a positive influence on policy change. You saw this slide earlier from Dr. Dietz, but this is how large the obesity problem is in the Latino community. Currently, 38% of our Latino children between the ages of 2 and 19 are overweight or obese, compared to 32% of all U.S. children. And this is obviously placing them at a higher level of risk for different types of chronic diseases. The top graph shows our Mexican-American boys in the red line, and they have higher obesity rates than their African-American and white counterparts. For African-American girls on the bottom graph here, also in the red line, their rates are not as high as African-American girls, but they are higher than their non-Hispanic white counterparts. And we all know that obesity has many negative impacts. We've talked about them already. Increased medical costs, higher risk on associated health conditions, and the list goes on and on. But you may not know that half of Latino newborns today, that's every other Latino child, will develop diabetes in the future. On this chart, you see circled in red are Hispanic male and female lifetime diabetes risk based on their BMI at the age of 18. This diabetes risk is higher for the Hispanic children. And there are many reasons why Latinos have a higher rate of obesity. One of them is access, so I don't have to go through that. But a lot of our children live in poverty, lack medical insurance, and don't receive the medical care that they need. Many communities have fewer grocery stores, and this creates food desert areas that lack healthy foods and increase the dependability on fast foods and corner stores. In fact, in a recent study that was conducted here in Houston, Hispanic kids eat too much fat, cholesterol, and sugar, and 2 of every 3 foods that they eat are either pizza, chips, dessert, burgers, soda, or juice. And not only that, but 54% of our adult community did not participate in recommended physical activity, and 67% of our Latino youth did not either. And an emerging issue is marketing to Latino children. You've heard some of our speakers address that. And the issue is why? Because Latino children tend to watch more TV, they tend to have higher cell phone usage, and they go online more than non-Hispanic white children. Latinos are also being targeted by marketers and digital marketers who are sending them messages touting unhealthy foods and sugary drinks. So how can we attack this problem? We created Salud America, which is a program funded by the Robert Wood Johnson Program. It's a national program in which we have built a network of over 1,900 researchers, policymakers, and other advocates in seeking data and testing solutions to the epidemic of Latino childhood obesity, and most of all, to build a field of researchers who are interested in this issue, and also to get advocates to focus on Latino childhood obesity. Put another way, because little evidence exists on the Latino childhood obesity and few researchers are looking at this issue, we became creators of both the data and data makers. Here are some of our national data, which I'll mention again just briefly, but I really encourage you to visit our website to learn more. We developed 3 new national research briefs that were just released last month to examine the current evidence of Latino childhood obesity issues with regards to the availability of healthy and affordable foods, the opportunities for physical activities, and the impact of food marketing on their diets. These briefs are helping policymakers make critical decisions in crafting policies and allocating resources to address the epidemic, and they are designed to have widespread applicability to Latino community organizations. Below, you'll see a screen grab for a video that's called Did You Know? This is a dramatic Latino childhood obesity video, which highlights data that I showed you earlier and other information as well, and it has had over more than 18,000 views on YouTube. And even more, it's become an important tool for community groups and school boards to use as a discussion starter at meetings to discuss childhood obesity. We also went through a Delphi survey process with our membership and created the first National Latino Childhood Obesity Research Priority Agenda. This agenda is the foundation for new and innovative research to identify the most effective policies and programs for reversing the obesity epidemic among Latino children. We used this agenda to create a call for proposals that wound up funding 20 grantee researchers across the country to produce results that can address the obesity issues in their own local communities. Right now, I'm going to highlight just 2 examples for you. And again, these are very small pilot projects. They were only 2-year programs, but they're making a dent in their community. First, we asked our pilots to not only do innovative interventions and create data in Latino communities that are disproportionately affected by obesity, but second, we also asked them to create individual research briefs and taught them how to use their data in political forums at local and grassroots levels. And again, going back to what Dr. Dietz said, we're really trying to create a social change in our Latino communities. So we're going well beyond just publishing the data. We're using this information to create change. One of our first examples is in Connecticut, where Salud America grantee Dr. Robert Dudley launched a Photovoice program that made Latina teen girls into powerful advocates for policy change in their community in New Britain, Connecticut, where the largest high school is vastly composed of Hispanic children. To identify factors that promote or prevent consistent physical activity among Latina teens, Dr. Dudley conducted several Photovoice sessions. Photovoice is a research tool and method that puts cameras in people's hands to assess community problems and assets, and then connects them to policymakers to pursue change. In Dr. Dudley's Photovoice session, adult and teen community members served as co-researchers in assessing the city of New Britain, Connecticut, and to identify barriers to physical activity. Shown on this screen is Dr. Dudley's matrix that if youth are empowered through Photovoice, their opinions and assessments can improve local programs and garner support from partners that spur policy changes. Photovoice can expedite that policy change by facilitating direct, informal dialogue between policymakers and Latino youths. Using the information and posters that, from their Photovoice experience, the Latina teen participants have already made a big difference in their community. They got a PE credit recovery program that is now a standard part of their high school program. This also included having bus routes that were modified to allow the girls to participate in the recovery classes. They presented their information to state legislators at a conference, and they met with transit officials on traffic and safety and sidewalk issues. 2 of the girls made stirring presentations to City Council, asking them to clean and to reopen 2 of their closed pools at local parks to add more physical activity options in town. Their own local newspaper said, 2 city teenagers put to rest the idea that young people are not interested in civic affairs as they presented their views on closing of city pools and the need for physical activity for city children. Dr. Dudley's group also plans to propose a Photovoice course as part of their New Britain High School Health Academy. This is a way to build Latina leadership skills and their confidence to give them the platform to contribute to solving the epidemic of Latino childhood obesity in their community. In another program in Utah, Salud grantee Dr. Zan Gao examined the impact of an ExerGame, which is a structured exercise program on physical activity on academic performance among urban Latino youth. The exercise program featured an interactive video game called Dance Dance Revolution, during which players stomp on a dance mat and mimic the steps of the on-screen dancer. Dr. Gao has compared his fitness levels and reading and math scores of students who did the intervention and compared them to a comparison group. He found that kids who participated in a structured exercise program at school were more likely to improve their math and reading scores and their one-mile run performance abilities. Dr. Gao found that this type of exercise can not only benefits academics, but he's also not stopping there. He's taking his results and offering it to other schools. And before leaving to Texas Tech, he's now a Texan, Dr. Gao's pilot results garnered him the support of the Salt Lake School District, and several elementary schools have adopted and implemented his program. And now in Texas, Dr. Gao has shared his results and has led to the implementation of the program in several local elementary schools in the Lubbock area. He has also implemented an after-school and homeschool program for kids in Lubbock, and the kids can come to the church to participate in the program. So that, again, this is the kind of data that's making a difference. And we're not just stopping there. We have helped all our 20 grantees transform the notion that they're not only researchers, but they can also be involved in the important role of policy development process. They're going beyond the data and using their data to create change in their communities. And we're doing this at a national level as well. Not only are we promoting the research briefs from each of our grantees, we're going to have a special supplement on their outcomes of their results, but we also are providing our information to local leaders to make a change. We encourage you to look at our blog and follow our Facebook and Twitter accounts as well, and we have a number of national figures that are following our information for Latino health issues. So in the end, as all of our presenters today share the example of how complicated it is to fight obesity, it's our efforts to solve this issue and attack this epidemic from every front, from basic science to nutrition to physical activity to media and marketing. And it's our responsibility to help our children. Thank you very much. Any questions? Yes.
Dr. Ramirez, I want to personally thank you for this study and the eye-opener editorial that you had in the Houston Chronicle. I'm very concerned about the growing population of Latinos in Texas and this problem. It's a problem for all of us, but it seems to be exacerbated in this population. Have you looked and compared to Latinos in other parts of the world, or looked at data from other parts of the world, and how does it compare?
This is an excellent question, and in fact, here in the United States, we have very little data on the different comparison groups, and one of the first studies that I started in cancer was particularly to look at differences among Puerto Ricans, Cubans, Mexican Americans, and Central and South Americans, and we find that Puerto Ricans and Mexican Americans tend to be on the lower end of the scales, mainly from economic status, and particularly those residing in Texas, because again, we tend to have less health insurance available for them, and they have less access to medical care.
So it seems to be more lifestyle than genetics. Is that the situation?
That's correct, and obesity is becoming a problem globally. You know, this is our next crisis after tobacco, as Dr. Dietz mentioned. So that yes, sometimes when they first got here, they might have been thin and gaining weight. So it's a lifestyle change, but we're also seeing this in other countries as well.
Thank you.
Yes.
Hi, I'm Stephen Pond, a pediatrician in Austin, Texas, and it was wonderful to see the panel and see a real translational research arm from bench to bedside to out in the community regarding obesity and childhood obesity, which is more my focus. Regarding a previous question from Dr. Shine, we see about 80% of obese teens will become obese adults, which really shouldn't be a surprise when we think of the toxic environment that we're throwing our kids back into. I think it was great also to hear about sleep and the depression consequences of obesity as well. And some studies show that the quality of life self-reported by children who are obese is the same as kids with cancer, and that's really another underlying aspect that we tend to not focus on substantially. So one thing that we certainly all need to continue our efforts is funding, and I'd just like to hear what any panelists or Dr. Shine or other folks' comments regarding healthcare plans, and what are their role in that. The solution's not in the doctor's office, but that's a component, and certainly everything that's in the community as well. But when we see that healthcare plans in Texas, Medicare, Medicaid, and the private payers don't even recognize obesity as a medical condition. I can see a child in my office who vomited last night. It's completely resolved. They're bouncing off the walls. All right, vomiting resolved, get my 20 bucks. If I see that same child because they're 200 pounds overweight, that's a declined condition. It's not recognized. And so we see the good Medicare reform that they're moving forward towards that nationally to recognize obesity and have some visits associated with that for adults, but it's going to require a lot of advocacy for us here in Texas if we want our Medicare, Medicaid, and private payers to do a similar model, and then hopefully also have community-based funding.
No, it's a critical question. I mean, access to care and getting the right information to our patients is very important. So I hope we do see some change. Yeah. I don't know if anybody else wants to address that issue.
Yeah, I mean, we've got to follow the money, and a lot of money comes to our healthcare plans, and they're not really putting money towards obesity prevention or even treatment.
And we're getting lots of requests from our physicians say, can you tell us, they want to give their patients and their families more prescriptions about going out to do physical activity and wanting to know what are the nearest parks. And so there's a great way that in terms of public health and medicine can really come together to address this issue.
I think, too, we really need to look for methods of sustainability. So how do we get it in people's job descriptions? How do we get resources allocated, even a small amount of resources if you've got it as a line item? How do we get training for people to do this? How do we get succession? So you might have a program champion. How do you get, when there's turnover, how do you get the next person? So those are the things we need to be looking at getting and moving forward, I think.
Thank you, Steve.
Yeah, thank you for your presentation. I've been working with Hispanics for a couple decades in California and now in Texas. And one of the things we've noticed in working with Hispanic women is they have very large waist-hip ratios, and that's true relative to non-Hispanic whites and African Americans. And one of the physiology we've been trying to look at is whether there's some hypercortisolism that's contributing to this redistribution or distribution of fat, if you will. And one of the studies that has happened in LA at USC was suggestive, at least in Hispanic children, there is more stress and there is more turning on of this cortisol stress axis. And so, that probably impacts on things that Joel talked about eating behavior and things that John talked about. And so one of the questions is, how do you deal with that? And I'm sure Salud America hopefully is looking at some of that. And ours has always been physiology. What can we do to, lower cortisol levels physiologically? But I think it could be a very interesting observation relative to Hispanics.
Right. Well, this is where, nowadays we all know that our activity patterns have changed so much. Parents don't feel that it's safe to let their kids go outside and play. And so that's why we're seeing an increase in our kids watching more television at home because parents don't let them out. And all of these types of things, contribute to that stress level of these children. But it's something we need to look at. So thank you for bringing that up.
So this is more an observation, a question to the entire panel. It seems that, like in tobacco behavior, policy, regulation, environmental changes, and societal norms have played an enormous role in changing smoking behavior in this country, and that the same could be true with food and obesity. And yet we also have a very strong basic science and physiologic approach. And how do we combine these together, or do we combine them together? And it seems to me that it's the same is true with tobacco in a way. We study nicotine addiction, and yet drugs have not proved to be the answer on the national scale and on the societal scale in people changing their tobacco behavior for a permanent period of time. And so I wonder if there are some philosophical observations from the panel about the contribution of the basic and medical sciences together with these very important interventions and dissemination that the behavioral and population scientists are implementing now.
Well, one of the things that I'd like to add, Ellen, before is that obesity is just a huge issue. We're not going after one culprit, the tobacco. Here we have a number of culprits in terms of the food and beverage, the beverages that we drink and so forth. And so it's really a complicated issue from the social perspective, and it's going to really take us longer. We're about 20 years out where we were with tobacco and just starting this change of social change and creating that social environment. But I'll let the other folks address the physiological question.
You think they will?